One of the main categories of illness that my lifelong program addresses is cardiovascular health. I recognize that the number one cause of health illness, conditions, and death in America is related to illnesses of the heart and blood vessels. So as I introduce this idea to patients, they often have several questions they ask me, and I'd like to go over those questions with you today. What is the main cause of vascular disease? First of all, vascular simply refers to blood vessels. So we're going to be looking at things that cause damage or malfunction in the blood vessels. High blood pressure is one of those. Cholesterol is a large impact on how your blood vessels work. If you've had diabetes, even for a short period of time, but certainly years of diabetes, that affects the blood vessels in the heart. And smoking is a massive cause of problems in your blood vessels. So how do we check for that? We have an ultrasound device here at our office. We have clinics where all we do is check the condition of the arteries of your neck and around your kidneys and in your legs. And by doing a survey like this that includes most of the areas of your body, we can get a very good idea about the condition of your blood vessels. This gives us clues about whether you're susceptible to a heart attack or a stroke. It's very simple, painless, quick. Most insurance covers it, and it can be done right here in my office. Can cardiovascular disease be reversed? Cardiovascular disease can certainly be slowed down or stopped. You simply stop smoking, which I know is not simple. We get your diabetes controlled or reversed. We treat your cholesterol, and in some cases, we need to put you on a blood thinner like Xarelto. So vascular disease can definitely be slowed down and stopped. And in some cases, we do achieve reversal. What does vascular pain feel like? If you've known anybody, or if you yourself have had angina or chest pain due to vascular disease, then you'll know what that pain feels like. The best analogy I can give you if you've never felt it, and I'm not suggesting that you do this, but imagine if you tied a rubber band around your finger. You would get vascular pain from that. And it's not just the pain from the rubber band, but it's the pain from the lack of blood flow. Other people might experience something called claudication, and that refers to the pain you get in your calves or your legs from walking a long distance that's relieved when you sit down and rest. Is vascular disease fatal? So a heart attack is a fatal form of vascular disease. Stroke is vascular disease in the brain, and it's frequently fatal. And sometimes if the vascular disease in your legs is bad enough and causes an infection, you might have to have an amputation, and sometimes that whole process can lead to death. So yes, vascular disease is debilitating, it's very serious, and it can lead to death. And sometimes people ask, how do you get vascular disease? It is more likely to happen in people as they age. So aging is one of the risk factors, but that's mostly because our safety systems and our repair and healing systems don't work as well with aging, just like a lot of things don't work as well. Smoking is the number one factor involved in vascular disease. So if you're smoking, let me help you stop smoking. Number two major cause of vascular disease is diabetes. People who've had diabetes, especially the worse your control is, meaning the longer and higher your A1C is over 7 or so, those people are much more at risk for vascular disease. So if you have diabetes, you're at high risk for heart attack and stroke. People with high cholesterol are at higher risk for vascular disease, and people with uncontrolled body inflammation, they're more at risk for vascular disease. So if any of these conditions are familiar to you, then you need an appointment with me in my lifelong program to get your full vascular assessment done. Thanks a lot for watching. One of the things I love is to hear from you, and I learn a lot that way as well. And if you're thinking it, someone else is too. So please leave a comment and I'll answer it, and you can help me help others.